Good afternoon. Thank you for staying with us for the final stretch of the meeting. I'm a research associate at the Department of Psychiatry at UBC, and I was given the honor of announcing the awards for today's presentations. I know we had some outstanding speakers, and we'd really like to acknowledge them, and then also provide a wrap up with a few closing remarks at the end. Great. So we have a few awards. We have a Best Lightning Talk Awards, and also we wanted to acknowledge the Best E-Poster as well as a video. And so for the Lightning Talk, the awardee will receive a certificate and also an opportunity to present a workshop at next year's conference. And of course, a social media shout out, as we know that that's really the buzz these days, is to be acknowledged online through social media. So that will be done. And so our Best Lightning Talk, we have two recipients because we had two sessions there. And the first goes to Kelly McInerney and from Foundry North Shore. So thank you for presenting your talk on opioid agonist therapy for youth and young adults and your program evaluation at Foundry North Shore. So congratulations. And then also another Best Lightning Talk goes to Hannah Krippholt from UBC. And on your lightning talk, which was on the demographic and socio-structural factors associated with non-fatal overdose among patients enrolled in the Optima trial. So congratulations to both of you. And we look forward to a wonderful workshop I'm sure that you will lead at our next conference. And next we have the Best E-Poster and also Video Award. Again, there'll be a certificate. And for these two prizes we have would be featuring your e-poster as well as your video on our website, and also a social media shout out to you. So the winner of the Best E-Poster goes to a group, and that's Samantha Johnston, Gil Angela Dela Cruz, David Castle, and Sveta Vertagi. And I'm apologizing, I'm not pronouncing your names right, but I try my best. And you're from the Center of Addiction and Mental Health. So thank you for presenting your e-poster on women's substance use programming in forensic mental health and your findings from forensic service providers. And then our best video goes to Jose Juliet and Shauna Khalid. And that's from the Public Health of Sudbury and Districts. And your video on Insight, a supervised consumption and treatment services, was very well liked. So again, thank you very much. And I know the judges had a hard time because everyone I know did put your best efforts in. So for everyone who presented, thank you. And now just a few closing remarks. I think as we wrap up and sort of briefly review the day, I think that we were presented with a lot of different ideas and international examples that we can reflect upon. And certainly there are many gaps in care that need to be filled. But I think we also recognize that there are a lot of opportunities for innovation because we see these gaps in order to advance substance use care. And technological capabilities, I think, are not the limitation at this point. However, maybe digital literacy, connectivity issues, and some best practice guidelines need to be addressed and put in place. But other than that, the technology is there for us to make these innovative changes. A main takeaway for me was discussed earlier in the day, and that was the need for different systems of care to move together towards a strategic response. And rather than just relying on one single system to make the change and to be able to address the existing gaps in substance use care for patients. We do know that, for example, trauma plays a significant role in the development and the trajectory of mental illness and substance use disorders, as well as socioeconomic disparities, access to physical health care, ongoing issues such as chronic pain, and unstable or lack of social support, and other vulnerabilities, as well as many issues of equity and diversity all come into play. So until we address the underlying issues of substance misuse and dependence, we will remain in a crisis-driven mode and a crisis response mode rather than a proactive response. So in addition to increasing access to appropriate urgent care responses that can meet individuals where they are, I think we also need to expand our efforts to earlier intervention and earlier prevention. And when I was asked to prepare these closing remarks, I took some time just to reflect on the past several years of conferences we've had like this, and also the ongoing developments of virtual solutions for mental health care and substance use. And although this is only the second annual conference under this title, Michael has in fact spearheaded the first e-mental health conference in Vancouver 11 years ago. So I went back, and that was in 2011 was the first e-mental health conference. And in that meeting, interestingly enough, the focus was on improving access to care and delivery, and the application of social media as novel ways of delivering knowledge. So we're all well aware of how information via social media has pretty much taken off this past decade. Have we utilize that for engaging with patients? I mean, earlier Nick and Martha were just discussing that. So in some ways, maybe we can start catching up to what was brought up 11 years ago. Not saying we haven't done a lot of work, but it was interesting to look back on that. And also in one of those earlier conferences, one of our colleagues, Dr. Kendall Ho, who is a colleague at UBC, he's a professor in the Department of Emergency Medicine, he was sharing some interesting survey data, which was considered surprising at the time. So he shared that in 2010, 6 out of 10 adults in the US said that they access the internet for personal health information. And then a follow-up survey in 2011 found that the stats went up to 8 out of 10 adults. And then he also cited a similar survey in Canada that found 64 out of 100 Canadian adults said that they access the internet for personal information or health information. And that was in 2011. And it was considered high and quite surprising. But I'm sure that if the survey was done today, the numbers would be upwards of 90%, maybe, depending on the region. And also no longer exclusively the adult population. Because at that time, they didn't even think of surveying youth. But we know now that youth heavily rely on social media as their main source of communication and also information. So this social media usage and online activity can actually be utilized to develop, for example, predictive models to assess risk, to identify these risk factors within a dynamic system that can integrate targeted early intervention as well as relapse prevention, and also ongoing treatment, ongoing support can all be incorporated and utilized through these channels. So I think that the challenge is ongoing, but there are certainly a lot of opportunities to collaborate. We have many partners that we've heard today, all working on different solutions, all recognizing different needs and gaps. And I think that together we can really develop some better solutions to serve the patient population. And so with that, I'd like to thank all our sponsors and our partners for your generous support, without whom we really couldn't make this conference a free event. And we also have a post-conference survey that's available on Whova, and your feedback is really appreciated. You can find the survey on the left-hand column, that panel under resources. And if you can take the time to provide us with some feedback, it really helps us improve and also shape the organization of our future online events. The conference recordings, as many people have asked, will also be made available within the week. So please stay tuned for an email. We'll send you the links once they're uploaded. And then finally, I want to acknowledge the creativity and hard work of our conference team and the committee, who's really been working hard behind the scenes well before today, just to make today run so smoothly. A special mention to Marisha Boyd and Hasti Fadakar, who worked so intensively just to make today happen. So thank you very much. And then to the entire ACD research group, thank you so much. And then of course, our appreciation and acknowledgement to you, Michael, for your leadership and your vision. And I know that you're already working really hard on the next conference and the next event, which will be happening April 6th and 7th. So this is a little plug-in for our next conference. This will be our second online conference on high-risk substance use and overdose among youth. And last year, this youth-focused conference actually attracted over 2,000 participants. So we anticipate a really high turnout again. And I hope you do join us in that discussion. It's quite a challenging topic, but we also know since the last time we met, a lot of action has been taken together as we've collaborated. So I hope you can join us. So thank you again for being part of this really inspiring meeting today. I hope you were inspired in your work from all our conversations. And this formally concludes our conference. Thank you.